Hi, welcome to the Shepherd Podcast. I'm your host. I'm Pastor Chris. The podcast is an opportunity to help you get to know some people here at Shepherd of the Hills at our church, school, and childcare, and also to discuss issues that I think might be of interest to you. And today my guest is a member of our church, Rhonda Falcon. Rhonda has been a nurse for 34 years. She works in the president's office at the UT Health Science Center just down the road. Her title is Patient Navigator. She has 2 children, Danielle and Bryce, and her parents also are a part of our church, Larry and Shirley Bowers. And so it's great to have the generations as a part of worship together. And now it's a great pleasure to be able to welcome for our interview Rhonda Falcon. Rhonda, welcome to the podcast.
Thank you. Thank you.
And we want to talk a lot about the COVID vaccine and your part in that, because you were very hands-on on the front lines for that. So that will be the majority of the direction we want to go. But first of all, I have to ask you, Patient Navigator, what does that mean?
Well, so in the president's office, as you can imagine, he gets a lot of calls from donors and supporters and that need help with a patient, with appointments. So I'm sort of the liaison for that. And
okay.
Yeah. So that's what I do.
What's it like working in the president's office?
Oh, I love it.
Yeah?
Everybody's super nice, and President Henrich is really, really nice and really funny, and he's great to work with. Yeah. So
now you've been a nurse for 34 years. What other things have you done over those 34 years?
So I started out with I was an ICU nurse for my first 10 years of nursing, and then I did cardiothoracic surgery, and then I did lung transplant for 10 years. 2 of those years were in New York.
Wow.
Yeah.
Yeah, I remember that time when you went away to New York.
To New York, yeah.
Yeah.
I went to help start a new lung transplant program up at NYU.
Wow.
Yeah.
That must have been interesting to be a part of a lung transplant program and to start a new program.
A new program. Yeah. It was great. I loved it.
Yeah.
Yeah.
What all goes into starting a lung transplant program?
Oh, so they already had a transplant program for liver and kidney transplants. So they were adding lung and heart. And so we knew what we did here worked. So actually the doctor I worked with here recruited me to go with him to New York. And so we so you have to obviously meet with a lot of physicians, do a lot of outreach to get referrals, and then you have to apply for Medicare and UNOS approval. It's a whole process. It's a lot. Yeah.
Wow. So you've been involved in some pretty heavy duty things in the medical field.
Yeah, it's been a lot of fun.
Yeah. So you bring all that experience into what you're doing now, and then it sounds like you're just doing a lot of work with people.
Right.
And helping the president's office in that way.
Right. Mm-hmm.
Okay. So let's talk about the vaccine and COVID and how all of that affected your community. And the first thing I want to ask you about was just the initial reaction in your community when the whole pandemic, when the COVID issue first arose. What was that like where you were working and in the Health Science Center as a whole?
So it's sort of funny because at the beginning of March, I had flown to Colorado for a wedding. And right then it was there was a little bit of talk about this COVID and the coronavirus, but nothing really there weren't a lot of restrictions or anything like that. It was just sort of talk about New York and maybe a little bit in the Northeast. And so when I flew, we didn't wear a mask, but only probably one person in the whole Denver airport had a mask on. Uh-huh. And that was the only time, that was the first time I actually wiped down stuff on the airplane, because I had never done that before. But I just felt like I probably should.
Yeah.
And then when I got back, if you traveled, the UT Health Science Center made us self-monitor our temperature morning and night for 2 weeks and keep a log and submit that. So I did that when I got back, which I thought, well, there must be something going on if we have to do that, right?
Yeah.
So then it wasn't too long after that a lot of the CDC guidelines came out. So we had to mobilized a lot of volunteers to screen our staff and employees and some patients coming into the Health Science Center.
Okay.
We restricted entrances. We took temperatures for everybody coming in. We asked them all the COVID questions, and that was every day.
Every day.
Every day you came in, and you had to get a sticker for your badge to show that you had been screened.
And you're talking how many employees?
A lot. Well, a lot initially, and then a lot of them started working from home.
Oh, okay.
So it was still a lot, but probably not as many as there are back on campus now, obviously. But yeah, it was a lot to get people to help screen all those stations and be, staff all those stations. So
sure.
Yeah.
Now, in addition to the screening and those kinds of protocols that had to be put in place, what were some of the other major decisions that reached the president's office as a result of COVID?
So, like I said, there were sort of direction for people to work from home. That was one thing. They restricted all travel, and they really encouraged you not to travel, even personally. And they weren't approving any travel for work. And at the Mark, where we see patients, you couldn't bring anybody with you to an appointment anymore. And then also a lot of those went to telehealth appointments too. So they did it over the computer.
Okay.
Yeah.
So it really changed the dynamic in a lot of ways.
Right. A lot of Zoom meetings, Teams meetings, which was different for everyone also.
Sure.
And we all wore masks at that point.
Yeah.
Yeah. So.
Yeah. Now, before the vaccine, did your duties change as a result of COVID?
Yeah, so I did a lot of the screening stations so I did that almost every day. I did it for our building, and then I switched and did it for the main entrance to the Health Science Center too.
Okay, so you were right there on the front lines every day.
Every day.
Every day.
Yeah, being the mask police and taking temperatures and asking questions. Yeah. Yeah.
Did you ever have to turn anyone away?
I did.
Yeah?
Yeah, for temperature. Yeah.
Yeah. Did the person comply?
Yes, they did. Yeah.
Well, good. Hopefully, if you're going to have a temperature, they realize they need to, go lay down
right.
or take it easy.
So we would have them set for, about 3 minutes or so and retake their temperature because a lot of this happened in the summer, obviously, and it's 100 degrees outside, and they're
hot.
Coming in from outside, and their temperatures were high. So
Yeah.
So.
Yeah. Wow. Interesting times.
Yeah.
So, as you look at the community in which you served, what would you say are there some lasting changes? Some, not just during the midst of the pandemic, but has it changed permanently some things in your field?
I think there are still some people who are working from home, and they've learned that they are able to work from home and still do their job, which to me looks a little more permanent for those kind of people.
Yeah.
Even though they have said as of June 1st that we all could return to campus.
Mm-hmm.
Other than that, we don't require masks in our buildings anymore. And that was just recently too, probably within the last couple of weeks, sort of like here at Shepherd it's going to be.
Yeah.
And we took all our screening kiosks down too, which we just did that about a month ago as well.
Okay, so backing off of those things.
Yeah, backing off of those kind of things. So as far as lasting things, it's probably more of some people working from home. I guess that's probably the biggest things.
Mm-hmm.
Yeah. So unfortunately, I was always able to go into work. I never worked from home, which I was happy about. So.
Yeah, you'd rather get out.
Oh yeah, absolutely. I needed to feel more normal.
Right.
Right.
Yes.
Yeah.
It's nice to see people, even if all you see is just this part.
Exactly. Yeah.
So what was the most stressful moment in the midst of the pandemic from your point of view?
I think after a while, I think people got what they called, like pandemic fatigue. People were tired of wearing masks. At first everything was okay, and it was sort of, it sort of took light of some of the things, and then we realized this was a lasting kind of thing. And I think the fatigue really hit people, and that was the hardest part.
Yeah.
They were tired. They were tired of getting screened every day. They were tired of wearing their mask, and tired of not seeing people and things like that. And it was hard. It was hard. Yeah.
Can you pinpoint about when you think that fatigue really set in?
So we probably started really screening people middle of March, wearing masks, probably around August, September, maybe something like that. It was hard.
And it still went on for many months.
It still
after
went
that.
on. It did until we got the vaccine. Yeah.
Until we got the vaccine.
Well, even after the vaccine. Yeah. But
Yeah. It's been a gradual rollback.
Right.
Yeah.
So.
Okay. So, what were some of the early sentiments in your working community regarding the vaccine? What did your colleagues think about it? What was the general vibe around the Health Science Center once the vaccines were being developed and then distributed?
I think for the most part, everybody was really excited.
Yeah.
We were like, finally, this is something that's going to end the pandemic, and I think I really only probably talked to one or two people that were opposed to getting the vaccine that actually worked at the Health Science Center, which really surprised me.
Yeah.
But I think for the most part, everybody was very excited and very happy. So, yeah.
So the medical community, I would think, as a whole, embraced the vaccine.
Absolutely. Yeah.
I mean, it came out of the medical community, the science community.
Right.
For those within the medical community or the science field, what reasons would they give to oppose the vaccine?
This one doctor I talked to had said that he didn't think there was enough research that had been done with the vaccine to know the long-term effects of it.
Yeah, I've heard that.
And we had heard that, and I just really was surprised because he is one of our doctors that does lung transplants, and I just was surprised he would say that, but that's what he felt. So
sure.
I think he ended up getting his vaccine eventually, though.
Yeah, I've heard that as well.
Yeah.
People who say that they feel there wasn't enough research around it or not sure what it'll be like long term, and there's no way to know what something's going to do long term, but you can predict it.
Right.
You can't tell the future, but you can predict it.
Right. I mean, we don't have any long-term data because it's only been out for a short time, right? So, yeah.
Right. Okay. Now, how have things changed since the vaccine was available? Have you felt a change in how people are feeling in terms of their safety or going forward, or a sense of optimism? Have you noticed a change?
Yeah, I think there's a sense of optimism. I think at first when the vaccine came out, people were still very cautious, about going out and meeting with people and that kind of thing until more people were vaccinated.
Right.
But you could definitely sense there was a change. This is finally something that's going to help us get over this, and you could sense that. So,
yeah.
I think, I really felt for, when I was doing the vaccines, I really felt for my friends that I knew were doctors and nurses and PAs. You could just see how tired and fatigued they were when they came and got the vaccine,
Really?
Yeah. So I really felt for them.
And what was putting that stress on them? Was it dealing with the COVID patients?
They were dealing with the inpatient COVID patients. Yeah.
So you could really see that was
oh my
wearing
goodness.
on them.
Yes.
Yeah. And has that load lightened considerably?
It has, absolutely, yeah, because, we had, I don't know how many floors were probably converted to COVID units at University Hospital, but of course, I think everything's sort of back to normal at the hospital by now. So, but
that's great.
Yeah.
That's great. Now, it seems like when there's something that needs a person right there on the ground, they've turned to you, whether it was screening and taking temperatures or distributing the vaccine. I mean, you were the one putting the shots into people's arms.
I was, yes.
And I mean,
from day one. Yeah.
How many weeks were you doing that, or months?
So we gave our first vaccine the second or third week of December.
Okay.
And I did it until, let's see, we were in June. I gave them till March or April, because then we had the National Guard that came and helped us.
Oh, really?
Yeah.
Okay.
They did, yeah.
What was that like when the National Guard
Oh my gosh,
stepped in?
it was so cool. So I walked in one day to go help, and I'm like, all these people in uniform were sitting giving shots, and I'm like, where did these people come from? And then I realized they were assigned to us for, I think, 8 weeks or something like that to help with vaccines, because we also depended on volunteers to help give the vaccine as well. So it was people from the nursing school, it was nursing students that helped give the vaccine. Mm-hmm. So whoever could help came that day. There were never, it was never, like, we never knew who actually was coming and how many people were coming. So to have that help and to know that they were going to be there every day was really nice. Mm-hmm.
So for a while, I mean, from day one, you said, I mean, you start your day giving vaccines and you do all the way until it's time to clock out.
Yep. Yeah.
I mean, are we talking 8 to 5?
Yeah.
Vaccine nonstop with maybe a little lunch break?
Yeah, it was a lot. You don't even know, you sort of lose count of how many patients you do over the day.
Yeah?
Yeah. And, you ask them the same questions, and then some people, but you know what? The people were so appreciative and so thankful to be able to get the vaccine that it really made it worthwhile.
Yeah.
Yeah, it really did.
Yeah.
Yeah, you could tell.
Yeah.
Yeah. In fact, I vaccinated some people from our church.
Oh, how about that?
Yeah.
Yeah. What were some of the things that people would say to you?
They would just really just say how thankful they were. They've been waiting for this. They hope everybody gets the shot. They were just really, really appreciative.
Yeah.
Yeah. So, yeah.
Yeah. How did that feel to know that you were making such a difference for people?
That part I really, really enjoyed. Even though you'd go home at the end of the day just exhausted, you don't think you're going to be tired giving shots all day, but I really was. By Friday, I was really, really tired.
Yeah.
But that having people tell you thank you really made a big difference.
Yeah.
Yeah.
Those two words do make a big difference, don't they?
Yeah, they really do.
Yeah. And you got that, it sounds like, a lot during the day.
We did. Yes, we did. Yeah.
That's great.
Yeah.
Yeah, well, absolutely. The work that you did and the whole medical community in our city and our nation, it's very much appreciated.
Right. Well, you're welcome. I was glad to be a part of it. Yeah.
And now things have gone more back to normal for you?
They have, yeah. So I'm not, obviously we closed our vaccine clinic at the end of May. And so we're not doing those anymore.
Okay.
The Medical Arts and Research Center, our clinic, is still giving vaccines, as well as some of our other UT Health clinics are. But I think all the big vaccine hubs have closed now. So like University Hospital had a big vaccine hub over at Wonderland of the mall of whatever it's called. The Wonderland Mall.
There off the highway.
Yeah, right. And then, of course, there was the big one at the Alamo Dome. I think, obviously, those are all closed now.
Yeah.
So
now, they reached a point where, at first, it was the supply-demand was everybody wanted it, and we didn't have enough at that point. And then it reached the point where there were more vaccine than there were people coming to get it, right?
Right, that's correct. So I think what happened was people, once the vaccine came out, everybody wanted it.
Right.
And I kept saying, you're going to get it. We obviously wanted to go by what the CDC guidelines were to the tiers, the different tiers, and where you fit in that tier is where you got the vaccine, right? And people panicked and they felt like they weren't going to get it, and so we vaccinated probably a lot of people out of sequence, we probably, but I kept telling everybody, you're going to get it. Even like my daughter Danielle, she's 25, and I said, you're going to get it. You just have to wait, Right. And of course now, like you said, you can get it anywhere. You can go to anywhere and get the COVID vaccine. So
yeah. Now, is this something that we'll have to get every year, like a flu shot?
I think that's the feeling, is that we are going to have a booster every year.
Okay.
Yeah.
Maybe you go in and get both at one time. Get your
I'm
flu
hoping.
Shot and your
I'm
COVID?
hoping.
Yeah.
I'm hoping. Yeah. Because I think doing it at different times is going to create a lot of logistical issues.
It'd be double the appointments.
Yeah, double the appointments. Yeah.
Yeah.
Yeah. And not everybody gets their flu shot, but I bet everybody's going to want to get their second COVID vaccine.
Yeah.
So,
yeah.
Or their booster. Yeah. So.
Now, from your perspective as a nurse and someone who works in the Health Science Center, what would you say are the lasting effects, the enduring legacy, let's say, of the pandemic? How have things changed, and it's probably going to stay that way? Or do you think things are just going to go right back to the way they used to be for the most part?
I think they probably will. I think it's going to take some more time. Even now going to HEB, almost everybody still wears their mask, and I don't think you really have to at HEB anymore.
Yeah.
There's still people who wear their mask at the Health Science Center, even though we don't have to. So I think it's going to be gradual, but I think eventually we will get back to things being normal, or as they were last year. Yeah.
Is there any concern in the medical or science community that another pandemic may break out at some point, some kind of variant or mutation?
I think there's always that thought, because we've heard about the variants and, but we really haven't seen them here. And so maybe there's probably not as much worry about it, but I think that's probably going to be in the back of people's minds now,
Yeah.
So, and with everybody wearing their mask and doing their hand washing, flu season was hardly anything because of that, right? And so I think if we go back to not wearing masks and things, that flu may pick up again next year, things like that, things that we didn't think about this year.
Yeah.
So
I've been vaccinated. I have a bunch of cloth masks that I've been using. Do I throw them away? Do I keep them just in case another pandemic breaks out?
I would keep some.
Okay.
I would keep some. I've thought about that too, because I've got a whole pile in my closet also.
Yeah.
I thought, do I make a quilt? Do I make a pillow?
Oh, wow. Wouldn't that be something?
Right. Yeah, I would hang on to your mask. Yep. I would hang on to some.
Yeah, you never know what's
You never
around
know,
the corner,
right? Yep. At least we'll be prepared. So.
Yeah, exactly. Yeah. Well, I'd like to pull back a little bit and talk a little more about your career and how this fits into the context of your career. Would you say that this was one of the more challenging seasons of your 34 years in nursing, or how would you compare it to some of the other big things that you've been through, and what would those things be?
So I think it was it made a big impact, but because I wasn't involved in direct patient care, like in the hospital, it probably didn't affect me as much as if I had been in the ICU or something like that.
Yeah.
I think we've learned a lot, and as nurses during this season, and I've have a lot of nurse friends that had to go through this as well, especially being in an inpatient, taking care of inpatients. But probably not as challenging for me as it has been for others who've been on the front lines.
Yeah.
So, yeah.
What have been some of the other challenging things that you've been through in your career? What stands out to you?
I think probably going to New York was probably one of the biggest challenges I've ever had to do. First of all, going to a new city by myself, and that was probably one of the biggest challenges. But it was probably one of my biggest accomplishments too. So. Sure. Yeah. And of course, ICU nursing, I loved it, but those patients are hard, and that was tough sometimes too. But I loved it. Yeah. Yeah.
Do you feel like the role that you're in, that's going to be a good role that you want to continue in for quite a while?
Probably so. I have a lot of years of service with the Health Science Center, so I will probably end up retiring from there because of all my years of service. I have almost 20 years already. So.
So as a Christian, as a believer, how does your faith factor into how you approach what you do? How do you see God at work in all of this to bring a pandemic, hopefully, to a resolution? Do you think about those kind of things, how God is at work in all of this?
I do. Of course, during this time, you say a lot of prayers.
Yeah.
But you also, when I was doing the vaccines, people, you could tell that they were Christians by the way what they said,
Really?
and that sort of opened the door to reaffirm your faith as well, and I saw that. I saw that a lot. So,
Yeah, great. Well, just to get to know you a little bit more as a person, can you elaborate a little bit on your family and who's in your family?
Right. So Bryce, he'll be 30 in December. He lives in Tennessee with his wife Nikki. He moved back to Tennessee after graduating from 8th grade here at Shepherd of the Hills. And then Danielle, of course, she's married to Andrew. He teaches at Lutheran High School.
Right.
She's working on her master's in recreational therapy right now. She also graduated from Shepherd and Lutheran High School and Concordia University in Austin.
Well, that's a lot of Lutheran education.
A lot of Lutheran education.
Yeah.
Yeah. A lot of private education.
Right?
Yeah.
Right.
Yeah, right. But it was the best thing for her. She loved it. Yeah. So, and then they got married. Danielle and Andrew got married last year, sort of during the pandemic. They had to postpone their wedding once. And then, of course, when we finally did have it, we didn't have the number of people that was originally going to come.
Right.
So, And some people wore masks to the wedding, some people didn't. And I sort of held my breath for about 2 weeks after the wedding to make sure nobody got COVID.
Right.
So that was a little tough.
Yeah.
But and then of course my parents, they're from Virginia. That's where I'm from. And they moved here about 3 years ago to be closer. I have a twin sister. She lives in Montana.
That's right.
So they chose to live closer to the daughter that has the warm weather.
Can't argue with that.
Until we had the snow this year.
Yeah, who would have thought?
Who would have thought?
Who would have thought?
Yeah.
And what's your twin sister's name again?
Rhonda.
That's right. We've got Rhonda and Rhonda.
Yeah. Yeah.
Very good.
Yeah.
And were you raised in a Lutheran household, or how did
Southern Baptist.
Southern Baptist. I was thinking it was something other than Lutheran.
Yeah, Southern Baptist.
But you became very a strong supporter of Lutheran education.
Absolutely.
So how did all that happen?
So it was when I guess it was when Bryce was going to start school where we lived. He would have gone to an elementary school that I couldn't even find one day when I was driving around. I'm like, I don't even know where the school is. And so driving to the medical center every day, I'd pass Shepherd of the Hills. And I'm like, oh, we should go check this out, you know. And so that's how they came here.
Really? Just by driving by?
Mm-hmm. Yep.
Wow, location.
Yep, absolutely. And it was great because if there were things that were going on at school, I just had to come, 5 minutes down the road and could be here.
Right.
So that was really, really nice. And then as they went through school here, then we started coming to church here and sort of just stayed. So yeah, I love it. I love it here. So.
And did your parents go to a Lutheran church before they moved here?
No.
Okay, so this was their first experience.
Yeah, so they actually visited some Baptist churches when they first moved here. Mm-hmm. I don't think they realized how spread out San Antonio is and how much driving you have to do.
Oh, yeah.
Yeah, so, and then, of course, they had been here with us before. Mom had been here for Grandparents' Day for school a couple times. And so then they started coming with me, and they just said, this is where we belong. So,
yeah. Your parents are great. They're very supportive,
yeah.
very kind people.
Yeah, they love it here, so.
Well, outside of work and the more serious parts of life, what do you like to do for fun?
Well, I also teach at Galen College of Nursing in the evenings. So, yeah.
So you don't sit still much.
No, I actually only have like one evening off a week, and that's on Thursdays. Oh, wow. So I love that, though. I love teaching. Yeah. And so during the pandemic, everything converted to Zoom as well with teaching, as like I did here, except I teach clinical nursing skills. And so it was a little tough teaching skills on Zoom.
Yeah, how did you do that?
Well, we did a lot of demonstration. I took a lot of stuff home with me, and we had to improvise a lot. So, yeah, it was tough. But now we're all back on campus. So, do
you think the students still came out knowing what they needed to know?
I think it was hard.
Yeah.
I think it was really hard. And, we sort of saw that in their test scores.
Yeah.
For a while. Yeah. So
it's hard to replace those things where you just have to be there
and do hands-on.
Right.
Yeah. And then they were supposed to do clinical as well, go to different, sites to do their clinical experience, and that all stopped as well.
Yeah. So my question was what you do for fun, but you told me about another job.
So that
what
was
do you do outside of that?
So well, that's a good question.
What would you like to do for fun if you had time?
Well, I do like to exercise. So I go to an Imbalance studio. We do Pilates reformer classes, bar, exercise bar. That's what I always have to tell people.
Oh, okay.
Yeah, not like the other bar.
Not going to the bar?
No, not going to the bar. And then, I love going to the Pearl, walking at the Pearl. I usually do that with a friend every once in a while. So things like that.
Yeah. Very good.
I just got a pickleball set, so I made to learn how to play pickleball.
Pickleball? I remember that from college.
Yeah. Oh, you do? Oh, good. Maybe you can teach me because I got the set.
I think I was pretty bad at it.
Oh, were you? Okay. Well,
yeah, I don't think it was a tall man's game.
Oh, it's not?
I don't
Again, the
so.
net's short, I think.
I think it was way down here. Yeah.
Okay.
Yeah, it was a little far down.
Yeah, so that was one of my, was it my birthday present from Danielle and Andrew? So, yeah.
All right. Well, I hope you enjoyed playing pickleball and become very proficient at it.
I hope so, too.
Yeah. Well, Rhonda, I want to thank you for taking time out of your schedule to have this interview with us today.
Sure. Well, thank you so much for inviting me.
You're welcome. It's been a pleasure.
Okay.
And thank you so much for watching and listening. I know you enjoyed getting to know Rhonda and getting that inside scoop on what it's been like during the pandemic and with the vaccine. Please join us next time as we continue to acquaint you with people from the ministry at Shepherd of the Hills. And until then, the Lord's blessings to you. May He keep you healthy and strong and safe and fill you with joy. The peace of the Lord be with you today.